As promised, we have the doctor inside the house. And you know, when we have a doctor inside the building, I mean, we are well taken care of, you know. Dr. Sandra Knight, anti-aging practitioner. Good night to you. How you doing, Doc?
Good night, Des. How are you?
I am great and doing fine. Doc, I have posted one of your pictures on my Facebook page. Mm-hmm. And a whole heap of somebody has said, what a young, pretty doctor.
Too kind.
Doc, what's up? How you do? What is happening?
I am super wonderful.
Wonderful. Great. What is happening with this Zika virus? What is Zika virus?
A lot is happening with Zika. Zika virus has now been declared today by the World Health Organization as a global public health emergency, meaning that all governments should and must dedicate all resources possible to the eradication of this virus. And what is Zika virus? Zika virus is related to, similarly to the chikungunya virus, but not in the same family. And it's just a similar illness to like dengue. So you get joint pains, achiness all over, a rash, and you feel feverish and have fever for a couple of days, and then you recover. But the problem with Zika, which is making it so important, is that Zika is now associated with deformities in babies. Otherwise, the one identified as microcephaly. So what happens is that the brain size and structure and function does not develop as it should. So your baby is born with an underdeveloped, underfunctional brain. And the child will have that for the rest of his or her life. Now, when you have an illness for your entire life, it's an economic impact that sometimes you can't even imagine it. And so if you have a country as small as ours, with 10 of those babies, we will have to commit billions of dollars to really treating those babies for the rest of their life. So that's why we are in a quandary to ensure that we do not have any incidents of microcephaly in Jamaica.
How sure are you guys, though, Doc? How sure are you guys that mosquito is our primary transfer?
Pretty sure. Pretty sure. And we in Jamaica, we have not done extensive studies on the virus in the mosquitoes. But the World Health Organization, CDC, has done extensive studies, and they have identified definitively that it is the mosquito Aedes aegypti that is the carrier of the Zika pathogen.
I want you to shed some more light, Doc, in the light of the pregnant woman.
Yeah.
Why is it so effective in damaging the fetus, that person, that baby that is within the mother? What damage does this virus commit? Explain all of this to me.
That's a good question, Des. How many people are not asking that question? But that's a very good question. All right. When a germ, which could be a bacteria or a virus, enters your body mounts an immune response. And the immune response is then used to kill the virus or bacteria in your body. Usually, if you have a pregnant female with an infection of some sort, most of the infections will cause, what will happen is that the immune response mounted by the body is what actually can harm the fetus. But in this case, Zika actually invading the uterus, invading the amniotic sac in which the fetus is found. And so what happens is that the actual virus is coming in contact with your baby and actually does direct harm. So that is why this virus is particularly dangerous.
Doc, a pregnant woman Somebody, a lady that is now pregnant, and hearing all these stuff that it's possible that it will affect their child. You know what I mean?
Yes.
Don't you guys have a lot of mothers coming to you or intended mothers coming to you with high blood pressure? Because they are thinking so much about this problem that this will actually raise the pressure and all the works. How do you guys as a doctor deal with the situation where you're having a mother thinking that the virus is going to hit her child and is a possibility that that child will actually born in a deformed way? How do you guys deal with a situation like this?
Based on the advisory, we can only share the mother's risk of contracting Dezzie.
Okay.
And if Dezzie is in the country, the risk is extremely high because the population is a virgin one.
Yes.
So far, it is only a 4-year-old that has an immunity at all to the Dezzie virus, which means that the other 2.8 million, we are immunity free against this virus, which includes all the mothers. Yes, if you are pregnant now and you get Dezzie, based on the preliminary findings of the World Health Organization and the CDC, it is a great possibility that if you get the Dezzie virus, your baby is very likely to be born deformed.
Wow.
That is why the advisory in many countries are definitive. There are countries that saying, do not get pregnant until 2018. Do not get pregnant until the next year. Do not get pregnant for the next 2 years. And they're giving definitive recommendations, almost instructions to women not to get pregnant. Because, there's really, you can have intensive vector eradication programs in terms of getting rid of the mosquitoes, but you don't know when a mosquito is going to strike and where.
Yes.
So we can protect the population in as much as we can, but we also would like the population to protect themselves.
Somebody's asking me, I've received a text just now, somebody's asking if this virus is catching.
What do you mean by catching? From person to person?
Person to person, yes.
No. It has to be given to you by a mosquito. So the mosquito ingests the virus from an individual and come and sting you and deposit the virus in your bloodstream.
And that same mosquito can bite another person?
If she lives, yes. If she bites another person, she will then give that person the virus.
The symptoms that you outlined earlier, Doc, are symptoms that can be related to other illnesses.
Absolutely.
How would you know that you really have Zika?
Definitively, you really need to do a genotype testing.
And what's that? What's that?
That's testing the genetic material of the virus that's in your blood, a specific antigen test. And that can be done at specific labs around the world, and they can identify the Dezzie virus definitively and confirm the presence of the virus in your blood. But clinically, it has a very characteristic generalized rash, which although can exist in other illnesses, because we're now facing this epidemic, if we see someone comes with fever and a rash, we are going to first attribute it to the possibility of a Zika infection. And so we'll do the studies geared towards that. And if it's not Zika, then we go down the line of other infections that can cause fever.
Doc, I heard a news somewhere that the Zika virus can be transferred via sexual intercourse.
Yes, minimally. I was reading the research. It's not conclusive. They found that the occurrence is unlikely, although possible. And so that is a possibility. But as you know, the virus, the transmission mode that we're focusing on is via mosquito. And in addition to that, though, if we're going to be preventing pregnancies as we should, then preventing any form of sexually transmitted illness will also be in the mix, because we'll be hoping that one of the measures you'll use are condoms.
Okay. So, Doc, patients walk into your office. They have a rash, they have a fever, they have all the stuff that you outlined just now.
Right.
The first thing that you will look for is to make sure you rule out the Zika virus?
At this moment.
At this moment.
Right.
So
if it were another moment, probably we'll be looking to rule out dengue. If it were another moment, probably ruling out chickpea. If it were another moment, probably ruling out something else, because a lot of these viruses have the same syndromic presentation. But it just depends on the viruses that are circulating in the environment at the time.
So if I have most of these symptoms, walk into your office, and would you just give me some medication and say, Dezzie, have a pleasant day, get well soon? Or you will say to me, Dezzie, I have to do a test on you and to make sure I rule out that you have Zika.
Well, Zika is a class 1 illness in Jamaica, which means that all persons suspected of having Zika has to be reported to the government, and tests for Zika has to be done. So no, I cannot say, hey, Dezzie, take a Panadol and go. I have to fill out the form to send to the Ministry of Health, get the samples to go to the lab, and in the interim, I may give you something until your results come back.
Oh.
But once I suspect it, I have to test for you and get your medical history, your travel history, and your personal history so that we can add it to the probable diagnosis.
All right, so just repeat what you just said to us, Doc. Are you saying, Doc, that if I walk into your office with some symptoms and it look like it's Zika, it's a possibility that you are going to say, listen, we have to fill out a form, pull some blood, and send it off just to confirm until?
It is not that it's a possibility. I would hope that it is an absolute must, because we are mandated by law to do that, because, as I said, it's a class 1 illness, which requires everybody to report any suspicion of any individual who may possibly have the virus. So I would not be able to send you home like that. I'd have to be very thorough in how I report the illness. There are specific forms to report the illness. There are specific samples to be collected. There's a historical information that I have to take for you. And then after all that workup, then I can treat you and send you home and be in touch with you when the results come back.
Oh. So in the wrap, Doc, just take us through the symptoms one more time and the possible treatment of this Zika virus.
All right. So if you have a Zika virus infection, you may have achy joints, muscular pain, pain behind the eye. You may have a headache, a generalized rash. You may have signs of meningitis, which is a very stiff neck, because that's one of the other complications of Zika. You have it can be complicated by meningitis and something called Guillain-Barré syndrome, where you have a temporary paralysis, unable to move generally.
Wow.
So that is also a very important complication, which is why I'm very happy for this opportunity to get the word out for us to encourage our families far and wide to protect ourselves, for this illness is very serious. And of course, you can have fever. Some persons may present with vomiting. Others may present with generalized weakness. But it's just like any other viral infection until the complications come along.
Doc, there are some of us who don't like to come to you, and we'd want to try our home remedies.
Right.
As a doctor, what would you encourage us not to use as medication?
All right, well, first let me answer what you had asked me earlier, treatment for Zika.
Right.
At the moment, there is no specific medication for the virus. They're working on it.
Doc, you know,
And
I
the
get me
only thing,
nervous, man. You get me nervous.
no, don't be nervous. Don't be nervous. We're working on it, Dezzie. We're working on it.
Oh, God.
But the only thing we can do now is treat the symptoms that you have. If you have a headache, we give you some for the headache. If you have a rash, we give you some for the rash. If you're itching, we give you some for the itching. Until we can find a medication or a vaccine, there's really nothing we can do. If you have BP, you just have to sit through the syndrome.
Wow.
Now, the question you asked, sir, the last question is very, very, very important. Because one thing that happens with viral infections is that your blood can get thinned out and you can bleed easily. That is why we don't recommend that you take things like Brufen or Catafan, because those are non-steroidal anti-inflammatories that can also thin the blood out. Many home remedies also thin the blood out. And if your blood is thinned out, you can have hemorrhagic/bleeding complications. So I would not recommend any home remedy at all. You know, it's difficult to give you exactly one. I mean, beyond some ginger tea, you know.
If a Desmond Williams, well, let me rephrase that question. If I, well, can I have the virus without showing the symptoms?
Yes.
Now that part is scary.
Well.
So can you imagine you have Zika? But can you imagine, Doc, having the Zika virus and you're not even showing the rash nor the fever and stuff like that?
But it will be scary to who?
To me, yes, to me, Desmond.
No, it's going to be scary because you're not feeling any pain or any discomfort. When it will be scary is if you have any complication of the virus, which is the paralysis or the meningitis or something like that.
Doc, as informative as this show is at this time, it's kind of scary. Doc, may I tell you, I have learned so much. I have learned so much from you just now. It's not funny. And gosh, can you imagine? I understand that we have one case of Zika inside Jamaica.
One case, a 4-year-old male.
A 4-year-old male.
Right.
Oh, Lord. Wow.
Right.
Doctor.
But just to let you know
that
my organization, because I'm chairperson of the National Family Planning Board Sexual Health Institute Agency, we are in charge of ensuring that our Jamaican women are protected against the possible complication of having children that are deformed. And we're doing our best. We have procured enough contraceptives of different types for the next year and procuring more. So we're working on it.
Doc, I must say thanks a million for taking time out from your busy schedule and to take the time to really educate us, because this is so important to us, Doc.
Not at all. It was my pleasure.
Gosh. And Doc, I know that you will be available if we have anything breaking and you want to just pitch out there into Radio Land. Dr. Sandra Knight, have yourself a pleasant night and thanks a million for stopping by.
You are welcome.
All the best, Doc.